This is WOWT 6 News, live at 6:30.
We begin tonight with a well-documented trauma often seen in our military. The stress can be paralyzing.
One local organization recognized what works for veterans in dealing with it could translate to those on the front lines of the pandemic. Brian Mastry has the details.
Sharon, Lauren, we've heard so much about the burnout, the stress of frontline healthcare workers during this pandemic. It's been a year and a half now that an organization that treats PTSD in our nation's veterans is now helping frontline workers.
Everybody's trying to keep their morale up and keep moving forward.
CHI Health critical care doctor Douglas Moore has been in the thick of the pandemic for a year and a half. He also understands other parts of his team, from nurses to respiratory therapists and beyond, are dealing with the same high patient loads while often understaffed.
Help each other out. We are willing to, if somebody's overstretched, willing to step in for the other. And so that does help. There's a lot to be said for, the teamwork.
Sometimes it's important to simply talk to a professional.
You don't know if it's going to be buried deep inside of you, and you need to really shine a lot of light on it to get rid of it.
Steve Kane is an Air Force veteran. For decades, he lived with the trauma of being beaten by 5 other service members.
I didn't even know I had post-traumatic stress disorder. I never even thought of it. And back in the 80s, I don't even think that was a thing.
In the last year, Steve Kane decided to get help for his post-traumatic stress disorder. The anxiety and fear became overwhelming.
The key underlying thing here with PTSD is that as we avoid it, it just sneaks up and gets bigger and bigger and bigger. And so just hoping it goes away is actually counterproductive.
A year ago, he began working with At Ease USA therapist Laura Fisher. So when memories come back now,
I have grounding techniques that I can use and deal with that was then, this can't hurt me now.
Now the organization is taking its skill set to work with hospitals.
A major health system reached out to At Ease USA and asked if we could help address the PTSD in their frontline healthcare workers.
Whether the trauma comes from medicine or the military, teams of experts are waiting to walk you through to better days. On your side, Brian Mastry, 6 News.